Welcome to Brainista, the podcast where we explore clinical topics using recent medical and scientific publications you may be curious to know. I'm Adrian, and with me today is Anna, our discussant expert, ready to unravel the complexities of modern medicine. Our mission? To extract actionable insights that you can use in your practice today. Today, we're tackling a fascinating question. Can magnesium in salt or organic forms, that humble magnesium we often overlook, be a game changer in pain management? More specifically, could magnesium sulphate be the key to reducing reliance on opioids, especially in post-operative care? Anna, I'm really excited about today's topic. We'll be referencing the narrative review, Management of Pain Using Magnesium Sulphate, a narrative review published in Postgraduate Medicine in 2022 by Solimanpour, Imani, Dolati, Solimanpour, and Shahsavarenia. And don't worry, links to the bibliography are in the description below.
So, magnesium sulfate, often abbreviated as MgSO4, is essentially the pharmacological parenteral form of magnesium, an essential mineral our bodies need. Now, for the cool part, it's a physiological voltage-dependent blocker of the NMDA receptor. NMDA receptors are like on switches for pain signals in the brain and spinal cord. Magnesium comes in and basically throws a wrench in the works, preventing excessive activation of these receptors. Imagine a dam controlling the flow of a river. In this case, magnesium blocks calcium influx like a dam, helping inhibit central sensitization. That's the process where the nervous system gets ramped up, leading to chronic pain. This is how magnesium can reduce pain hypersensitivity.
Anna, that's fascinating. So where does magnesium sulfate really shine in the world of pain management, specifically neuropathic pain? What's the scoop there?
Neuropathic pain is a beast. It's that burning, shooting, electric shock-like pain caused by nerve damage. Think post-herpetic neuralgia, that lingering pain after shingles, or the nerve pain that can come with diabetes, diabetic neuropathy. Now, what's interesting is that magnesium sulfate has shown some promise in tackling these conditions. Several studies suggest it can be a helpful add-on when other drugs just aren't cutting it. It's like bringing in the closer in the ninth inning when your other pitchers are struggling. For example, the paper mentions that a 2-week course of intravenous magnesium sulfate followed by oral magnesium supplements decreased pain severity and improved spinal mobility in patients with chronic low back pain that had a neuropathic component. And speaking of post-herpetic neuralgia, there's research suggesting that intravenous magnesium sulfate can reduce pain in those patients, offering relief when other treatments have failed. It really seems to settle down hyperexcited nerves.
Okay, so neuropathic pain is one area where magnesium sulfate can be helpful. What about other types of pain? I'm thinking headaches and kidney stones. Are there benefits there?
Absolutely, Adrian. Let's talk migraines. We all know how debilitating those can be. Magnesium steps in as a potential reliever, mainly due to its NMDA receptor antagonist superpowers. It's like it throws a wet blanket on the overactive nerve signals. Studies suggest that magnesium supplementation, even just simple oral magnesium, can significantly improve serum magnesium levels and provide pain relief for migraine sufferers. Think of it as slowly refilling a depleted tank. And for those in excruciating pain from renal colic kidney stones, magnesium can provide relief and may even lower the need for opioids or opiates.
Fascinating, Anna. What about after surgery? Post-operative pain is a huge issue, and we are always looking for better ways to manage it. What role, if any, does magnesium play in post-operative pain management?
Great question, Adrian. Post-operative pain is where magnesium sulfate can really shine as an unsung hero. It's not meant to be the star of the show, but a valuable supporting player in a multimodal approach. Think of it as the drummer in a band, keeping everything together and enhancing the overall performance. Intravenous magnesium sulfate can be used as an adjunct analgesic to reduce post-operative pain and decrease the amount of nonsteroidals and opioids needed. Now, it is important to remember that the research is a bit mixed, but many studies do point to its benefits. It's like adding a pinch of salt to a dish. It enhances the other flavors. And let's be clear that timing and dosage are absolutely critical. You can't just sprinkle it on and hope for the best. You need to be precise. Think of it like baking a cake. Too much or too little of an ingredient, or adding it at the wrong time, can ruin the whole thing.
So, Anna, let's distill all of this fantastic information into something really memorable and actionable. What are our key takeaways here?
Okay, Adrian, let's come up with a catchy phrase. How about magnesium soothe, block, and support? It's short, sweet, and to the point. Soothe for migraines and renal colic, block for neuropathic pain, and support for post-operative analgesia.
Love it. Magnesium, soothe, block, and support. That's definitely going to stick in my head. Now, what are 3 clinically actionable points that our listeners can start using today?
Great. 1. For migraine patients, consider magnesium supplementation, especially if they're looking for alternatives to traditional medications. 2. In neuropathic pain, think about magnesium sulfate as an adjunct therapy when first-line treatments aren't cutting it. 3. Perioperatively, explore intravenous magnesium sulfate as part of a multimodal approach to reduce intra- and post-surgical opioid consumption. Remember the timing and dosage.
All right, Anna, let's tie this all together. So we've unpacked the multifaceted benefits of magnesium sulfate, from quelling migraine storms to easing post-operative discomfort.
Exactly, Adrian. It's like having a Swiss Army knife in your pain management toolkit. It's not a cure-all, but it offers real value when used strategically.
So what's our call to action for our listeners?
It's simple. Consider magnesium supplementation as a valuable addition to a multimodal analgesic approach, especially in patients where you are seeing post-operative pain, neuropathic pain, migraines, and renal colic. Tailor the dosing, time it right, and see if it makes a difference in your patient's outcomes. For example, 1 to 4 grams in divided doses intrasurgically or for acute pain, and magnesium glycinate 300 to 600 mg daily by mouth. As long as the renal function is preserved, then the risk of hypermagnesemia is exceedingly low and transient. Problems do arise when the renal function is compromised, where lower doses of magnesium supplementation can lead to hypermagnesemia, leading to skeletal muscle weakness, hypotension, cardiac dysrhythmias. Recall that in preeclampsia, the woman and the fetus may be getting 1 gram of magnesium sulfate per hours or days. That observation, the important role of a healthy kidney function in the prevention of hypermagnesemia. Clinical professional judgment and guidance is paramount. Also, recall the recommended oral daily recommended allowance is around 400 mg per day. Just for reference.
Thanks so much for all of your expertise today, Anna.
My pleasure, Adrian. Always happy to dive into the brain.
Listeners, remember to check the description for links to the paper we discussed today, Management of Pain Using Magnesium Sulfate, a narrative review published in Postgraduate Medicine in 2022.
Disclaimer and bibliography in the description.
That's all for today's episode of Brainista.